Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener. Welcome back to another episode where the topic is specifically on uterine disease. I will continue exactly where I left off, discussing uterine pathology in the last episode and what could go wrong with the human uterus. Now, last week, I discussed adenomyosis. So if you're interested in that topic, please revisit that episode. What I'd like to do at the beginning of each uterine pathology episode is recap and preface the episode with the main uterine problems that can occur in a woman's life. So 1, adenomyosis. 2, uterine fibroids, also known as leiomyomas. Those are benign tumors of the uterine wall. 3, uterine tumors called sarcomas. Those are malignant tumors of the uterine wall. 4, endometrial cavity disease. And that consists of endometrial polyps, endometrial hyperplasia, endometrial scarring, also known as synechias, and endometrial cancer. And 5, uterine prolapse. So I'll continue talking about the uterus, and I will focus in this episode on uterine fibroids. These are also called leiomyomas, and in layman terms, uterine tumors, nodules, or cysts in some cultures. So what are uterine fibroids? Uterine fibroids are benign tumors that range vastly in size. They're extremely common uterine disease. It's literally a growth of tissue, of the uterine wall tissue, and it can manifest as a singular problem, just one single fibroid, or multiple fibroids. And of course, depending on the size and location of the fibroids, it will cause different symptoms. Now, these tumors, nodules, cysts, call them whatever you want, these fibroids are always solid, and they're made out of this fibromuscular tissue that literally grows out of control, sometimes to very extreme sizes. For example, the size of a football or even larger. These tumors can develop inside the uterine cavity, inside the uterine wall, or they can grow from the uterine surface outside the uterus into the abdomen. Imagine it a little bit like a cauliflower, with the center of the cauliflower, that hard core being the uterus. It's not exactly like that in real life, but it could be just as funky as that. Now, sometimes these fibroids develop on a stalk, like a stem, what we call a pedicle. So for some reason, there's a huge, large fibroid sometimes that's just floating around inside the abdominal cavity, linked to a tiny little stem to the uterus. So why do the fibroids happen? Well, that's an excellent question. Unfortunately, we don't really know, but we do know that there are quite a few factors that matter. So let's discuss these factors. 1, genetics and race. There is a very strong genetic component to the formation of fibroids, and it is much more prevalent in African American women, significantly so. For example, only 6% of Caucasian women under 35 will be diagnosed with fibroids, whereas 25% or more of African American women will be diagnosed with fibroids in the same age group, under 35. 2, and a very, very important factor at that, is obesity. The development of fibroids seems to be related to a higher body mass. and their presence is much more likely to happen in obese women. That doesn't mean it won't happen in very thin women. It does. Number 3, and literally the most important, is estrogen. Now, this is the elephant in the room. Highly unbalanced estrogen, again called estrogen dominance, will lead to fibroids. Remember this, if you're going to take anything out of this episode, fibroids love estrogen. So women that have a very early first period, have a very late menopause past 53, 54, and women who might have had very high estrogen levels throughout their 20s through the 40s are very likely to develop fibroids. Both estrogen and progesterone stimulate formation of fibroids. How do we know that? Because research and studies show that after menopause, when estrogen declines and disappears, the fibroids shrink significantly by maybe 50% or more, which is why when you are diagnosed with fibroids, you might be told to wait for menopause, because the doctor knows once the estrogen is gone, your fibroids will likely cease bothering you. We'll talk more about that in a little bit. And number 4, last but not least, age. Most of the times, the presence of small fibroids is literally expected to happen in women's uteruses as they age. A fibromatous appearance of the uterus on an ultrasound is very likely as a woman gets older and older. The formation of fibroids with old age is looked upon as a degenerative condition that comes with older age. And just like many men suffer from prostate issues as they get older, so will women possibly after perimenopause and menopause suffer with fibroids. So bottom line, we don't know what causes them, and we do not know how to prevent them. However, once you are diagnosed with fibroids on your uterus, you should be aware that they love to grow and they love to bother you, especially if you still make estrogen naturally, or maybe you are now in menopause but using hormone replacement therapy. So let's talk surveillance of the fibroids, and I will do that when I discuss treatment options in just a few minutes. But let's talk about natural evolution. I mentioned the fibroids love estrogen and they love to grow, especially when they get fed estrogen. So could fibroids disappear completely and naturally? Not very likely. Why? Well, because once these tumors form either inside, within, or outside the uterus, they are likely to shrink, but will not disappear completely. These tumors are composed of swirls of muscular fibrous tissue. And this type of growth, this type of tissue can be shrunk, but it is impossible to literally melt them away or make them go away. With medicine, with herbs, with supplements, with cleanses, with acupuncture, we can't even make them go away by zapping them with radiofrequency or other technology that we'll talk about in a little bit. That's because they are so solid. Imagine your uterus will grow different size Brussels sprouts that have a very hard core. The outside softer part of the Brussels sprout can probably shrink, but that hard core will always be there. So they can shrink, but they will not disappear once they've formed. So let's talk symptoms. What do fibroids feel like? Well, sometimes they're so big, you can simply feel them easily by pushing on your lower belly, and you feel them. They float around. In some thin women, you can actually see and feel the enlarged uterus very easily above the pubic bone in the lower abdomen. Now, fibroids are usually painless, and sometimes they can grow to quite impressive sizes before a woman feels anything is unusual. But most of them will usually cause some kind of pelvic pressure. And due to the displacement of the neighboring organs, they can actually cause some major issues. For example, fibroids developing anteriorly on top of the uterus and anteriorly towards the bladder will compress and will put pressure on your bladder, not allowing it to expand fully in between voids, making you want to urinate a lot more often and also have some urgency as well. You might also want to wake up at night to pee. The bladder doesn't have space to open and accommodate more urine in the middle of the night, so it will start contracting and sending you signals. This is all I can do. This is all I can accommodate. Please get up and pee. So that's not enjoyable at all. It ruins your sleep. Fibroids that develop posteriorly on the back of the uterus, especially in women who have a uterus that's retroverted or flipped backwards towards the sacrum, they might cause significant back pain, making a woman see many doctors and have quite a number of MRIs and epidurals before her GYN doctor discovers the fibroids. So if you suffer from chronic back pain and you know you have a tilted uterus, please have your doctor check you for fibroids. It could be a very easy fix for your back pain. However, the most common symptom is bleeding. So remember this, fibroids like to bleed. Most women will present with bleeding, heavy menstrual bleeding, prolonged menses, intermittent random bleeding, bleeding with sex, etc. Again, another common symptom is pain. As the fibroids tend to grow, they will tend to outgrow their blood supply and might suffer degenerative changes, which means their inside core suffers and can turn ischemic due to the insufficient supply of blood and oxygen, releasing inflammatory cytokines and causing significant pain. Anti-inflammatory drugs like ibuprofen, Celebrex, Advil, Aleve work really well in these cases. So we have pain, abdominal or back pain, we have bleeding, we have pressure symptoms, and urinary problems. So how does the doctor diagnose your fibroids? Well, fibroids are very easily diagnosed with a regular GYN exam or an ultrasound or both. A pelvic ultrasound performed by an OBGYN with an in-office ultrasound during your annual checkup should be very easy and is an ideal, simple way to diagnose the presence of fibroids and provide quite a bit of information on their size, location, number, etc. So we talked about what are fibroids, what are the symptoms of fibroids, and how we diagnose them. So last but not least, let's talk solutions. How do we treat fibroids? Well, ideally, we would address the cause of the problem. Unfortunately, that's impossible because we do not know what causes fibroids. So we do not know what we should do to prevent them. But we do know that estrogen is involved. Therefore, the most effective medical treatment for uterine fibroids, which can produce significant fibroid shrinkage, are different drugs that we have available. Some of them are called gonadotropin-releasing hormone agonists or GnRH agonists, and they're very effective. Unfortunately, these medications effectively shut down your own production of estrogen and progesterone, causing a temporary menopause that will be very effective at shrinking the fibroids. So again, to recap, we don't know the cause for the uterine fibroids, but we do know that cutting off the estrogen will effectively give a woman relief from the fibroid symptoms. So that is what these medications do. Unfortunately, they also give her, the poor woman with fibroids, the gift of menopause symptoms. And obviously, I'm being sarcastic about it because there's no gift. You're not really gifted anything when you have menopause symptoms. Now, I personally don't think that this is an effective solution at all. It is very temporary, and such treatments with these GnRH agonists, which by the way come in the form of shots, are not recommended for more than 9 to 12 months. They're also horribly expensive, and most insurance companies might not cover them. Once the treatment with these medications is stopped, your body will resume its own production of estrogen, which will literally take you right back to where you were when you started the treatment. So ideally, we can use these medications as a bridge to something else. So let's talk about what that something else might be. Lifestyle changes, treatment of estrogen dominance to allow much better estrogen, progesterone, testosterone balance, a bridge to menopause when all estrogen is gone and the fibroids can start shrinking naturally and will stop bothering you. That is very true. But what is also true is that many other things will start bothering you at menopause when the estrogen is gone. So you literally just trade one nuisance for another. So there's not necessarily a solution, but more on that to come. And last but not least, surgery, fibroid removal by a trained surgeon. So let's talk surgery. Fibroids themselves can be removed surgically by a simple procedure called myomectomy. It's not that simple, but for a trained gynecologist, it's relatively simple. The uterus is opened up and cut into right on top of the fibroids. The fibroid is dissected or shelled out, and then the uterus is simply sewed back together in that area. It does create a scar in the uterus and will require delivery by cesarean afterwards if a woman gets pregnant after a myomectomy. The advantages of myomectomy is that it allows a woman to keep her uterus, especially if she plans to have more children, or if she is very attached to her uterus emotionally, as some women frequently are. A definite disadvantage of simply removing the fibroids by a myomectomy procedure is that we are leaving behind an organ that already has a problem. It can produce more fibroids, requiring additional myomectomies or eventually a hysterectomy. So simply performing a myomectomy without allowing or considering what caused the fibroids is not the ideal solution. There's also endometrial ablation. Now, endometrial ablation, it's a simple procedure, not really surgical because we not remove or cut anything. We simply burn the lining of the uterus, but it only treats the symptom of bleeding and does not really treat the fibroids at all. It is literally a better treatment for adenomyosis or small submucosal fibroids that bulge or interfere with the uterine lining. So is there anything between drastic drugs that put a woman through menopause or drastic surgery that removes a woman's uterus? That is the key question to ask. Well, the conventional medical approach to fibroids for any gynecologist is to simply treat the symptoms first. So for example, if we treat the bleeding, there are many hormone therapies that are treating the symptom of bleeding. The Mirena IUD, a low-dose birth control pill, a progestin-only pill, the newest Orilissa pill, etc. We can also manage bleeding from fibroids, especially when that bleeding is simply heavy periods, with tranexamic acid. It's a clotting agent that can be used for just about 2 days, maximum 3, around your period time to help decrease blood flow drastically. Pain can be treated with over-the-counter non-steroidal anti-inflammatory agents like ibuprofen, Aleve, Advil, Celebrex, etc. So let's talk about a couple technologies that are in between drastic medication, in between drastic surgery. Many women have never heard or have never been offered a uterine artery embolization. This is a minimally invasive outpatient procedure that will significantly help fibroid symptoms and can significantly shrink fibroid size. There are small particles that are injected into the uterine arteries by an interventional radiologist. They will help reduce the blood flow into the fibroids, and the fibroids will then slowly reduce in size over the next 3 to 6 months by about 50%. Some notice a reduction in size of over 70% by the end of the first year. Now, that highly depends on how vascular that fibroid is. And it's probably more effective if the blood flow to the fibroid is significant. Now, the risks and side effects with this procedure are not zero. And I recently had a client with a hematoma of the groin artery, which led to some serious issues. Also, when the blood supply is cut off from the fibroids, they can become ischemic, so they are depleted of oxygen. And this ischemic process will release a lot of inflammatory cytokines, which can cause significant amount of pain, often requiring narcotic use for a short period of time. The second technology that you should know about is laparoscopic radiofrequency ablation of the fibroids, called the Acessa procedure. This is a minimally invasive outpatient treatment that involves a few small abdominal incisions. It's a laparoscopy. It uses controlled radiofrequency energy to heat and cause coagulative necrosis of the fibroid tissue. What is unique about this procedure is that allows imaging of the uterus with an ultrasound in real time while doing the laparoscopy. So the doctor can identify and treat nearly all fibroid locations within the uterus. The laparoscopic camera will be positioned above the uterus, as usually through the belly button incision, and that gives the surgeon a panoramic view. And there's a small laparoscopic ultrasound wand to be applied directly to the uterus right over the fibroid. So between the panoramic view from above the uterus and the ultrasound wand, the surgeon will be provided with two different views of the uterine fibroid. Once the uterine fibroid is located, a very thin device is used to deploy several small needles into the fibroid itself. And then these deployed needles will be heated up and they will destroy the fibroid tissue by dehydrating and desiccating it. Again, this procedure shrinks the fibroid, does not destroy it completely. Remember about the analogy with the Brussels sprouts or the cauliflower, there's that hard core right at the center that will not go away. Depending on the size and the location of the fibroid, this procedure might not be an appropriate option for all the women that have fibroids. And of course, laparoscopic, ultrasound skills, and Acessa skills are also necessary. I would like to mention here another novel type of treatment that's treating fibroids with focused ultrasound, a treatment that pairs MRI with special sound waves called high-intensity focused ultrasound, or HIFU. This treatment is called MR-guided HIFU, where the Acessa procedure requires an experienced gynecological surgeon, and the device itself, which is made by Hologic. This treatment is performed by an interventional radiologist that needs to have access to a special MRI machine. There are no incisions or needles required for this procedure, and more than one fibroid can be treated during one session. This treatment is considered best when the fibroids are small or medium-sized. And it is not appropriate for free-floating fibroids that are hanging on a stalk, those little pedunculated or bigger pedunculated fibroids, or for fibroids that are located in an area where sound waves cannot reach, or there are other organs between the sound waves and the fibroid, or the fibroids are very close to sensitive organs or critical body parts, nerves, arteries, bowel, etc. As it turns out, if you live here in Los Angeles, in the greater Los Angeles area, UCLA has the machine. So you might be able to get this treatment if you feel after counseling that this is the appropriate treatment for you. So as you can tell, we have a lot of options. Please be aware there is no such thing as this is the best medicine, or this is the best procedure or the best surgery for all the fibroid cases, because the perfect treatment for you will depend on your age, on whether or not you are done with childbearing, on how severe your symptoms are, on how many fibroids you have, how large they are, where they are located, on whether you are approaching menopause or not, whether you are desiring hormones postmenopause or not, whether you are emotionally attached to your uterus or not. And last but not least, it will depend on availability and whether or not your doctor will present all these options to you. Now, in today's climate of low reimbursement from insurance companies, you are likely to be realistically offered about 1 to 2 options, maximum 3, as your doctor will need to save time and make it to their next appointment. So the doctor will not have 30 minutes or more to explain everything as I laid it out here for you. But to quickly recap, you have a lot of options. You have medical, surgical, and non-surgical options to help shrink or cut out the fibroids. Those are from medications like tranexamic acid and ibuprofen to birth control pills and an IUD, gonadotropin-releasing hormone medication, and all the way to removing the uterus completely via a hysterectomy. That is the only definitive curative treatment for fibroids, a hysterectomy, which is removal of the uterus. Just like for adenomyosis in the previous episode, the only cure for that was hysterectomy. This is also very, very valid for a fibroid uterus because once it is all said and done, fibroids are very hard to get rid of completely in a natural, holistic way once they're there. It's very hard to treat them effectively with medication or non-surgical technologies because both medications and non-surgical technologies will leave the uterus behind. And if leaving the uterus behind at the same time, we are not treating the condition that led to the fibroids, is simply going to allow more fibroids to develop, or the treated fibroids will grow again. Maybe new ones will develop, as the uterus is likely the fertile ground for fibroids for a reason. Ideally, integrative functional medicine will help you find the reason. Detect whether or not you have estrogen dominance, insufficient progesterone, excessive estrogen levels with minimal or no testosterone, and provide you with a solution. We do need to start looking beyond simply the estrogen being the culprit, as the estrogen is one of the most amazing hormones we have been gifted as women. But just like real life, when you receive a gift and you don't know how to take care of it, many women can ignore signs and symptoms that tell them that they are imbalanced hormonally and will wait until it's too late and fibroids have already developed. I have talked about these signs and symptoms ad nauseum in my first series of episodes about estrogen, so please go to the specific episode about estrogen excess and estrogen dominance to learn more. The bottom line is that we women are awesome at abusing our bodies and ignoring signs and symptoms of hormone imbalances for years before we decide to do something or seek care. We are masters at that. So if you live a stressful life, you have disturbed sleep, you do not exercise every day, you have developed cravings for sweets and salty foods, you have a less than perfect diet, you are more than likely already hormonally imbalanced. And that's me right here. I fit that picture completely. However, I am at menopause, so I am just getting my hormones. I'm not making any. So I am careful to track the levels and to pay attention to the signs and symptoms because 1 ounce of prevention is worth a pound of cure. So we're all guilty of that, not paying attention. Again, I'm going to repeat this. I do believe that 1 ounce of prevention is worth a pound of cure. I highly encourage you to partner with a physician that can holistically look at the big picture and guide you towards optimal health. Too often, women seek help only when they are in trouble and they have already suffered for months or maybe years. The key to preventing fibroids is regular checkups with your gynecologist, regular hormone checkups, at least annually, if not every 6 months, especially when there are signs and symptoms like the ones I mentioned before. The key to optimal health lies in a partnership with a physician in a practice that knows you by name, knows all your medical conditions as soon as the doctor enters the room and greets you. Remember, your gynecologist should be more than just a doctor who does your annual pap smear and delivers your babies. I will end here, leaving you with this critical piece of advice regarding your uterine health. Please ask your doctor to perform an ultrasound with every annual exam. Most doctors have advanced ultrasound machines in their offices now. Also, please ask to have your hormones checked, even when you are young and you think you're healthy. Blood flow during menses is highly subjective, and whatever is considered normal flow by someone can be a totally heavy flow for someone else. Many women put up with heavy menstrual flow, not realizing it is a sign and a symptom of possible uterine disease. So please be aware of how important it is to keep an eye on your uterine health, because your uterus is at the center of your pelvic organs, and it is intimately connected to your ovaries, your tubes, your fertility, and a healthy uterus is a sign of a healthy body. Before I close this episode, let me say a few words about sarcomas. I talked about benign tumors of the uterine wall, so I'd like to say a few words about malignant tumors of the uterine wall muscle. These are called sarcomas, and they are deadly. They're very aggressive. We unfortunately cannot tell very well when a fibroid-like tumor in the uterus is a sarcoma. And most sarcomas are diagnosed when the uterus is removed by the process of hysterectomy, which is usually done for fibroids. So a lot of the times is an incidental diagnosis. So keep in mind, bleeding that does not respond to the treatment with progesterone or decreasing the estrogen or stopping the estrogen, bleeding when estrogen is low, or having a fibroid that grows in the absence of estrogen or when estrogen is low, are indicators that this might be a sarcoma. Always consider an MRI, especially if your doctor suggests it, because it can clarify whether your fibroids could be at risk of actually being sarcomas. I will end here, and next week I will continue talking more about circumstances in which our uterus can be affected by uterine polyps, endometrial hyperplasia, and continue the series of episodes about uterine pathology. Thank you for listening. We'll meet again soon. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.